Hello, my name is Abby Cheng, and I'm here to present a preview of the article called Shared Medical Appointments to Improve Equitable Access to Rehabilitative Care for Long COVID. This was published in the January 2025 issue of CPTJ. In the article, we present a novel method of delivering physical, occupational, and speech therapy to adult patients who might not otherwise have access to one-on-one therapy or who might appreciate learning along with other patients who have similar symptoms. We specifically apply this method to deliver long COVID care, and we share a detailed outline of the structure and content of the rehab program. But in reality, shared medical appointments could be used to deliver rehabilitative care for a wide range of commonly occurring conditions, not just long COVID. To pique your interest in reading the article, I'd like to share a bit more about what we did and why we did it. So first off, why is it important to think outside the box and identify novel ways of delivering therapy? Well, as many listeners have undoubtedly experienced, it's unfortunately very common for adult patients to encounter financial barriers to receiving physical, occupational, and speech therapy. In fact, some state Medicaid programs and safety net health insurance plans don't cover one-on-one rehab visits at all, and this barrier affects patients who have any number of conditions which benefit from therapy. Long COVID is just one example. So long COVID is an infection-associated chronic condition that can cause a wide variety of symptoms and long-term functional impairments. While investigation into curative treatment is ongoing, current standard management of long COVID relies heavily on physical, occupational, and speech therapy. Therefore, patients who face barriers to receiving therapy are significantly and unnecessarily limited in the functional gains they can make while living with long COVID. So next question. What can we do to improve access to therapy, particularly when Medicaid and other safety net health insurance plans don't cover one-on-one therapy? Our approach was to harness shared medical appointments, often abbreviated SMAs. SMAs are group medical visits in which multiple patients who have a shared medical condition interact simultaneously with one or more clinicians. SMAs have most often been used in primary care settings for conditions like diabetes and heart disease, or for delivering prenatal care. But in reality, SMAs can be used to deliver multidisciplinary care by a wide range of health professionals, and they're widely reimbursed by health insurance plans, including Medicaid. SMAs also offer the added benefit of peer support and camaraderie, and they're an efficient method for clinicians to deliver care to multiple patients at once. Because of these features, SMAs can serve as an innovative method of delivering therapy principles for patients who cannot access individual appointments with a physical, occupational, or speech therapist. So, what will you learn by reading this article? In the article, we present a detailed outline of a long COVID therapy curriculum that covers physical activity and exercise, daily living activities, and thinking and speaking. The 6-session program includes identification of functional concerns and goals, instruction and rehab strategies and tools, and troubleshooting challenges that are encountered as patients try out different recommended strategies. The content presented in this article is intended to be easily adapted, updated, and delivered by other clinicians in order to facilitate more equitable access to long COVID rehab care. Furthermore, the nuts and bolts that we present regarding how to implement SMAs can be used by therapists who treat other common functionally impairing conditions besides long COVID. So if you're interested in an efficient and engaging method of improving access to therapy, check out Shared Medical Appointments to Improve Equitable Access to Rehabilitative Care for Long COVID. Thank you.